Welcome, wise women of Menopause Success Mastery. I'm going to come to you today and share a little bit about some of the health and hormone information that I've put together and learned from some of my other mentors. So I'll be sharing a couple of different slideshows with you today to sort of go through overall information about what our hormones do, how they're working, what happens during our perimenopause and menopause years. And this is pertinent information even if you've had a hysterectomy, or if you're no longer having menstrual cycles, or if you're kind of in that in between area where maybe my body's going to have a period this month, maybe I'm feeling some of these symptoms. To just give you a basis of information. And I'm going to speak to you as an aromatherapist too. So I'm going to give you some aroma points and some essential oils that have been really helpful for me and the clients that I work with. So I'm going to go to my share screen and start with this. All right. And first off, I want to just add the disclaimer that this presentation is for educational purposes only, and it's not meant to diagnose or prescribe any type of particular condition. And if you do have difficulties, be sure and talk to your healthcare provider about it. But maybe you can use some of this information as a tool to actually get there. All right. So in this presentation, I'm going to identify some key hormones that are important in women's health and how they work in the body. And then I'm going to discuss some hormone disruptors and the relationship to the olfactory system. And we'll explore some symptoms that you might be experiencing now as a result of some imbalanced hormones. I know some of you have taken my hormone balance detox, and you'll get some information in that program as well. And this is just here to support that in this program. We're going to hone in on the essential oils and their role that help restore and rebalance hormone health. And then you'll get an introduction to aroma point therapy as a way to address women's health. And then I'll share some recipes with you that are relative to hormone health as well. So just some safety reminders as we begin. There's a great resource at NAHA, the aromatherapy organization that I'm part of. And you can go there to their Explore Aromatherapy and the Safety tab. There's also some good information if you have women in your family that have fertility or pregnancy issues. There's some other good information in there as well. I just want to touch on some of the essential oils that may have photosensitivity to them. So any of the citruses, and you can find, again, that information on the NAHA website. So the key hormones related to women's health that I really feel are important, and I've seen the most relativity in talking about women's hormone health, and that would be estrogen, progesterone, and cortisol as the top three. And then I like to put insulin and leptin, your thyroid hormones, especially the T3 and T4, and the TPO antibodies are important when getting testing. Cholesterol, which is a hormone. Serotonin, which helps us sleep or not. And dopamine are happy hormones in the brain that give us that feeling of just overall sense of well-being and happiness. All of these can be disrupted during perimenopause and menopause. The olfactory pathways for hormones, and I find this so fascinating. As an essential oil is breathed in through the vapor, you've got your inhalation. It goes through the lungs and then into the bloodstream, and then is flushed out through the kidneys, the skin, and the lungs again. Now, when it goes through your nose and into the olfactory nerves, it hits the limbic structure, or the oldest part of your brain. And from there, it goes to the cerebral cortex and creates those aroma memories and responses in the emotional part of the brain. It also goes to the hypothalamus, the pituitary gland, and then is sent out as receptors to the receptor sites in the body regarding various hormones. And that's how essential oils can actually balance your hormones. It's an area that I find so fascinating in the overall picture of hormone balance, that this is one of the quickest, easiest, most effective ways with no side effects that you can make a shift in the emotional, mental, physical, and spiritual body and help balance hormones with just that inhalation of an essential oil. So that's why I really like to focus on hormone health in this way. So a little bit of background and a little bit of science here about what's happening when you smell an essential oil. When we talk about endocrine disruptors, we're talking about non-organic, genetically modified foods, which you'll learn about in my hormone balance detox program. Other things that can disrupt hormones are alcohol, caffeine. Alcohol increases your estrogen levels. Caffeine increases your cortisol level, your stress hormones. Pesticides can mimic a lot of different hormones in the body and really cause a toxic load in your liver. Perfumes and body care products can mimic estrogen in your body and create elevated estrogen or estrogen dominance. Laundry detergents, there's a whole laundry list, if I can use the pun, of chemicals in laundry soaps and dryer sheets and things like that. These chemicals are called xenoestrogens, which are compounds that mimic estrogen in the body. So when you see that term used, you'll know what that means. You can go to ewg.org/research and look at their dirty dozen list of endocrine disruptors. And then you can start to look at your cleaning products, your laundry products, your body care products, and find those listed on the labels and find out what might be disrupting your hormones. Some of the symptoms that you may or may not have been experiencing with hormone imbalances can include weight gain, especially around the hips and belly fat. And it can be in the thighs as well, depending on which hormone is disrupted. Premenstrual or menstrual pain, if you're still having a menstrual cycle. Irregular periods where your body's like, building up. Am I going to have enough estrogen and progesterone to produce a period? Or am I just going to pretend like you're going to have one and then I'm just going to let it go? And nothing happens, which is so frustrating. And then you start counting the months to be, okay, have I been 12 months without a period so I can celebrate my one and only day that I am in menopause and be done with that. But the symptoms can still be there. You can have hot flashes and night sweats. Those can go on for a number of years. For some women, they can be decades. You can experience a low mood, some anxiety, which can trigger poor sleep, fatigue, and a whole array of different symptoms around that. So we'll take a little snapshot of lifetime hormonal cycles of estrogen and progesterone. So during your reproductive years, your years of fertility, your levels of progesterone and estrogen stay pretty even and level and high, giving you nice hair and skin and muscle tone and building calcium in your bones. All of those things, keeping your cholesterol levels balanced. And then in menopause, the peri-menopause years, which could even start at age 35. So it can start at a medically induced menopause where you've had to have your uterus removed because so now you don't have that detoxifying process, even if you keep your ovaries. If they've taken your ovaries, or if you've had cancer treatment where you go into a medically induced menopause, then you've got these wild, radical shifts in estrogen levels spiking and then falling really low and spiking and then falling really low again. And then progesterone here is just kind of sliding down the hill. you reach that point of menopause, which is one day in your life where you celebrate 1 year of having no periods, and then you're put into postmenopause. So here we've got that menopause is coming clear down. So as you're going through these menopause years, and then you have that one moment. And then you see the levels are very, very, very low, which they should be. The body prepares you by putting about 5 extra pounds around your middle, where it's storing hormones and fat. And those hormones are going to be released slowly over the rest of your life in this postmenopausal time to help calibrate this. So there are some things that you would need to do nutritionally as well, making sure you get calcium, vitamin D3 plus K2, um, magnesium supplements to help your bone health, eating really clean, a lot of cruciferous vegetables, those types of things to help maintain your gut health, which is going to keep your cholesterol and some of those other hormones working, and managing your stress. So those are all other side things other than what you can do with what I'll be talking about with essential oils. This other chart here just shows during your reproductive years what the fluctuations are in estrogen and progesterone in a normal monthly cycle of ovulation and then having that monthly period. So when we have signs of low estrogen as you reach that menopausal stage, some of the symptoms can be weight gain, especially with belly fat, fatigue and anxiety, depression, hot flashes, and night sweats. I'm sure you could add some more things to this list that you might be experiencing, but these are the main signs of estrogen levels decreasing. In regards to the hot flash, I've done this anatomy of a hot flash. There's a diagram of it in my book, Aromatherapy for Menopause Success. This sort of breaks it down. Your decreasing estrogen has an effect on the hypothalamus. Remember, we saw the hypothalamus in relationship to the essential oils in the inhalation process. So I love the connection between what's happening with the hypothalamus with a hot flash and how eventually we'll share with you what you can do for balancing that. So it's sending these inaccurate messages to the body that it's too hot. So the brain responds to alert the heart and the blood vessels and the nervous system that you need to be cooled off. The heart starts pumping faster. You feel that heat rising in you, and bingo, you're having a hot flash. And there's some relationships to the liver at that point as well that we'll talk about in a moment. So signs of too much estrogen in the body can be weight gain, especially in the hips. Again, fatigue, some irritability. This would be estrogen dominance. Poor sleep, not necessarily falling asleep, but maybe waking up several times during the night, usually between 1 and 3. And that's usually when the liver is involved. The liver is doing its detox process. And it's like, I'm feeling a little sluggish because I'm having the extra responsibility now of managing some hormones, since the ovaries aren't doing that as much or at all anymore. And then the adrenals are also having that extra taxation too. So that combination maybe of higher cortisol and more responsibility on the liver is initiating that response during the night and waking you up. Perhaps you're still having some irregular periods and you've got that irritability that comes with PMS. And of course, this is a time where you could be experiencing fibroids or endometriosis and some water retention. The uterus is that vessel of doing that detoxification every month with your monthly menses and sloughing off those toxins. And so now that that's not happening, again, there's more pressure put on the liver to take over that responsibility. So you may be holding in a little more water. Progesterone imbalances, which would be too low and too high. With too low, again, you've got weight gain, a lower sex drive, those mood swings and depression, Again, your PMS with irregular periods or even heavy periods. I know when I was going through perimenopause, I would have so much heavy bleeding, and my body was just not being supported enough with progesterone. Maybe some breast tenderness or the fibrocystic breasts. I know a lot of women who have to have lumpectomies or needle biopsies because they develop these toxins that are forming in their breast tissue. Again, I feel like some of that relates back to these xenoestrogens that we have as well. So there's some other play going on there as well. And oftentimes women will have gallbladder issues when progesterone isn't being supported. So there's a connection with the liver and gallbladder and progesterone levels. You also might notice some differences in your skin or moistness as progesterone and estrogen levels start falling. You may experience some vaginal dryness, those kinds of things as well. The tissues aren't getting as much moistness. Maybe the skin, you can see, oh, I've got a few more wrinkles, or my skin doesn't look as plump and juicy as it used to. If progesterone levels are too high, you have some breast tenderness as well, feeling bloated. I know I used to get that terrible bloated feeling. Mood swings. You may have the opposite of poor sleep and have excessive sleepiness. Again, I think there's some adrenal involvement there. Dizziness, which we don't think of when we're thinking about hormone levels, but this can happen, dizziness. And a susceptibility to more yeast infections or even vaginosis, those kinds of things. Cortisol imbalances. I touched a little bit on as you age, your ovaries pass that responsibility of hormone production onto your liver and your adrenal glands. And because of the stressful culture that we live in, our adrenals tend to be taxed out a little bit more than they should be at this point in our lives. And so that can affect your hormone balance if the adrenals are feeling a little bit more pressure. Weight gain can be experienced here in both the hips and the belly. Fatigue, again, poor sleep and insomnia, waking up. Depression paired with anxiety, low sex drive, and water retention. So you can see how you can feel like you're a hot mess, right? And, I don't share this information with you to be a Debbie Downer or make you feel like there's no hope in sight. I just want you to have the information so that you can really embrace, like, okay, this is happening to me. I'm going to acknowledge it. I'm going to own it. And then I'm going to be empowered with more information and people who are going through this at the same time with me to get through it and use this as a real fertile ground to my wisdom years so that I can understand it and share this with others and help other people, my daughters, my granddaughters, maybe a neighbor who might be going through this as well. So I'm going to talk a little bit about my 5 top essential oil allies in this realm. And clary sage, a sweet, sweet oil that I love. Rose otto, bergamot, geranium, and grapefruit. So let's dive in. Clary sage, I just think it's the best wise woman oil there is. It's so good at knowing when to adjust. If hormones are too high or too low, it adjusts in the body accordingly with the messages it sends out to the receptor sites. So it can be calming. It can relieve that premenstrual tension. It's antispasmodic because it has a high amount of esters in it. It's an antidepressant and it relieves menopausal symptoms. It just has this innate wisdom within it to know what to do. So it's one of my best go-tos. Rose otto, which really helps balance the heart space when I think of heart chakra medicine, and emotionally calming. So it's going to ease those mood swings. It's going to improve the serotonin levels, aiding in that transition to menopause. And it really has an affinity for the genital urinary system. So kidneys, bladder, um, all of um, all of those organs in the pelvic bowl. It's helping to balance and regulating female hormones. Bergamot is going to promote balance in the body. It's antidepressant, reducing anxiety, alleviating headache, tension, and pain, uh, and stimulating hormone production. It actually stimulates the production of progesterone. So my favorite point to use bergamot is the ear shenmen, placing a diluted drop of bergamot on the index finger, putting those index fingers together to evenly distribute the oil and gently rolling down into that point in the ear. So this energetic resonance, if this oil is going to travel this meridian, it's going to balance the left and right hemispheres of the brain and put you into a parasympathetic state of relaxation. And it's just such a beautiful mood balancer. I can't tell you how many times bergamot on shenmen has saved me from panic attacks and feeling overwhelmed during the process of perimenopause. Geranium comes up and shines as an emotional support, again, balancing those female hormones. It also helps balance insulin, glucose, and glucagon in the body, those hormones. So supporting the adrenals, acting as a liver tonic, and also an anti-inflammatory. Such a sweet, sweet oil. So in reducing cravings, I have an aroma point tip. And you can apply this to the bottom of your feet. And that's what I learned in reflexology. But I'm going to show you another point here. I've got my little foot here. And here's the big toe. And if you go into the inside or the outside edge of the big toe, at the base of that big toe, at the head of that metatarsal, I'm going to put it a little closer here. There are a couple of spleen points. And if you just rub the oil right there on the edge of the foot. This is often a place where you might have a bunion. And you just hold it there on both feet. That's a point that's going to support that reduction of sugar cravings, of sweets, and it's going to balance out the insulin, the blood sugar, the glucose, and the glucagon. So beautiful point to add morning and night. And then there's grapefruit. Grapefruit is very uplifting. It's going to increase your self-esteem. You know, maybe you're not feeling so good about your body image as you go through all these changes, and it's really going to help support you in that way. It's a citrus oil, so it helps move energy up and disperse it out. Just very uplifting, moving stagnation out of the body, stimulating lymphatic flow. It also stimulates the production of a hormone called leptin. So it's going to leave you feeling more satiated if you smell this before you eat a meal. So it's going to help in supporting some weight loss. And it also helps reduce cellulite. So applying it in a massage oil to areas that have cellulite, which always seem to be like upper thighs and maybe belly. It's a great one to put on. Again, it's phototoxic, so be careful when you're using it in regards to exposure to the sun. So I've listed out here, I would also, I've included hormone balancing blends here, the bergamot on shenmen to initiate the parasympathetic response of calming, and then clary sage on small intestine 19. So we're going to connect that brain and gut connection. So the brain and the gut are talking to each other, initiating those hormone balance of female hormones. We're going to connect rose to heart 7. I'll give you these diagrams here in a moment. Or CV17, which is in the center of the chest. This is to soothe and comfort the heart space during this menopausal transition. And then we're going to be using marjoram on GB34 to address the stagnation of the liver and gallbladder and its role in hormone balance. So here are the points. Here we've got ear shenmen, small intestine 19, which is right here in front of the ear, right there on that little fossa there, that little cartilage point near the mandible. GB34, which is on the outside of the leg, but below the knee. We've got heart 7 on the crease here, the outside of the hand. And you can study these a little bit more again as you want to. And then hearts are CV17 or REN 17 here in the center of the chest. So one of the protocols that I like to use for hot flashes, again, is the bergamot on shenmen. And then UB3, which is up here right in the hairline, and yin tong, which is the third eye with lavender. This is going to clear the heat and the agitation out. Then we're going to use large intestine 11 with mei chang. Such a beautiful oil. And what it does is it disperses. So it's going to clear that general heat by putting it on large intestine 11. And then we're going to go with liver 3 with blue tansy, again, clearing out that heat and agitation of the liver. And kidney 1 with vetiver, as we clear that heat down into the earth and bring up moistening energy from the earth. It's a beautiful, beautiful combination. So here it is. We've got the ear shenmen. Here's the yin tong and the UB3 up here. And you can hold those, but you can hold those all at the same time. I love to put the oil on my thumb and my the lavender and my 2 fingers, my little Spock hold, and just hold that there. It's so beautiful to just sit there and take some deep breaths. And then the large intestine point is in this crease, the end of the crease there at the elbow. And you can crisscross and do both of those at the same time. I love that one. And then that liver 3 point on the top of the feet, just sliding in the webbing in between the first, the big toe and the second toe. And you'll feel a little divot there. And then kidney 1, right up underneath the ball of the foot, right in the center. In reflexology, that's also known as the solar plexus. I think it's some beautiful support there with the vetiver. And then when you're feeling any tenseness or any excess tension in the body, one more protocol here using sweet marjoram to relax the tendons and ligaments with GB34, a gallbladder point. The sweetness of jasmine with that euphoric on pericardium 6 to support the emotional body. Again, we're going to use liver 3 on with blue tansy to soothe and move that tense energy out. Roman chamomile on CV12 to calm and relax the stomach. Just making our ability to digest what's happening in our bodies and let that antispasmodic quality of Roman chamomile soothe and smooth. And then using rosemary on CV17 in the middle of the chest to release and relax the chest as it releases that stress. So here are those points. Again, ear shenmen, the GB34 that we used before on the outside of the knee. PC6, which is in between the tendons down on the wrist. Liver 3, again on the top of the foot, in the webbing between the big toe and the second toe. And then we've got CV12, which is halfway between the belly button and the end of the sternum. You can feel that right in that stomach point. And then CV17 or REN 17 in the center of the heart space. Beautiful protocol. And here is a protocol for the dampness, maybe swelling, heaviness associated with the heavy period. You've got bergamot on shenmen. Spleen 8 with Atlas cedarwood. Beautiful oil to support that. You could use Atlas cedarwood, juniper berry, or cypress. Cypress is really good and has affinity with draining dampness throughout the body. So whatever your personal preference is, as you start working with these, experiment. Try different oils with these points to see what you feel moves things in your body. And then stomach 40 with juniper berry or maychang or palmarosa to help move that thick, damp fluids throughout the body. Stagnation. So here are those points. Got the shenmen in the ear. You've got spleen 8. Again, on the medial aspect of the leg. And down here on the tibia. And then stomach 40, it's going to be on the front of the leg, halfway down on the outer edge. And usually these points are tender if they need some tending to. And then any dysregulation in general, I like to use either clary sage, bergamot, black spruce, or frankincense. Clary sage on 0.0, that's a point in the ear. And I would suggest black spruce at a 50% dilution, frankincense at a 50% dilution as a spinal treatment. So here are some of those points, and I've included the spinal treatment as well. Beautiful. If you can get your partner or maybe a massage therapist or another therapist to do that with you, a friend maybe. And the 0.0 here in the ear. There's another endocrine point also that I love to use too, so I put that one in there. And the spinal treatment sequence I've got here as well. You can read through that. And here are some recipes for a PMS roll-on, so you can make this up. I like to use evening primrose as a base for this, or sweet almond oil, but evening primrose has an affinity to really help balance hormones. And I just put it in a little roller ball so I can use it over my belly there. A hot flash relief spritzer. I love to keep this at my bedside, so if I wake up in the night with a hot flash, I can just spritz this and turn on my fan. It just works so wonderful. And so that's there's some links here for clinical studies if you want to go a little bit deeper. And I'm so happy to share this information with you. I'll do another little presentation, a couple more, to present some more information on some of the clinical information that has come out in regards to hormone balance, so you can have a little more of the science behind it. But I wanted to share some aromatherapy points with you today to get you started. So I hope you find this helpful. Post your comments here and questions. I'll be happy to help you in any way moving forward. Thanks so much, and you're on the right path to becoming the wise woman.